Hello everyone. In today's video, we are going to learn about a new topic named staffing. So the term staffing is an orderly and a systematic process. So this orderly and systematic process require a sound rational. Rational means a reasoning, right? So coming to the meaning of staffing, it is selecting a set of people with predetermined standards, means to have a set of standards to be fulfilled by those person to take care of a group of patients in a particular setting. So there are different types of staffs available in an organization, especially in the hospital setup. The first one is the general staff, second one is the technical staff, and third one is the auxiliary staff. So these are the three types of staff which we see in a hospital setup. And selecting and training these people, motivating them, comes under the term called as staffing. Coming to the meaning and definition of staffing, it is a process of selecting, training, motivating and obtaining people with high competence skills and sufficient qualification to meet the job description in an institution or in an organization. So even before doing the staffing process, it is mandatory to know what sort of job should be fulfilled by a person in that organization. Based upon the job description, based upon the job necessity, we have to select a particular person or set of people to take care of patients in hospital. So what is the importance of the staffing, especially in different institutions and organizations? The first importance is to identify the right person and to put them in the right job so that they can work efficiently for an institution and organization. So when there are people to work for an institution, there is a continuation or survival of that institution or organization. And it also helps us to improve the productivity, or the work environment also can be improved when different people come together to achieve a single organizational goal. It also helps us to identify what are the different positions in an organization and how to select efficient and effective people to fit those positions. And once the staffing process is done, it also helps us to train the people and improve their work efficiency by providing different training programs to improve the productivity of the work. And at last, it also helps us to use the human resources to the optimal level without any wastage or confusion. Coming to the functions of staffing, so it starts with selecting, recruiting, training and developing their work productivity, right? So it is always a managerial function. So that is done in a managerial level to select the staff required for different positions in an institution or in an organization. And after that, we give them the job description, we introduce them or give them the orientation program, and workforce training is being given, and then continuation of that is performance appraisal, telling them how far or how come they are doing different positions in their job given to them. And at last, compensation also can be added in this functions of staffing. Now coming to the objectives of staffing. So the objectives first begin with providing all professional nursing professionals towards the wards or towards the special units like labor ward or operation theatre, emergency unit. All these units require all professional nurses, and the ratio also is like 1:1, especially in ICUs or intensive care units. They require nurse patient ratio like 1:1. And the next one is allotting nurses, professional nurses in medical wards, surgical wards, pediatric, obstetrical wards. The professional nurse patient ratio is like 2:1. And but certainly when it comes to a corporate hospital or any other hospital, now the present ratio of nurse and patient is like in medical, surgical, pediatric and obstetric ward is like 1:5 in the morning and afternoon shift, whereas in the night shift it is like 1:10. So this is the ratio being followed temporarily and currently in all the hospitals. And The other objective of staffing is mainly the responsibility of the nursing staff or the head nurse to allocate the duties for all the nurses according to their job description, according to their nursing skills. And also the objective of staffing is to ensure there is a quality nursing care provided to all the patients in 24 hours and 7 days in a week and 52 weeks in an year. And whenever any nursing programs or any conferences, continuing nursing education is being done, it is always necessary to involve all the nursing staff, including the head, for more productive ideas, and also involving them helps them to understand what is their next level. When they reach the next level, how to handle the responsibilities. And another objective of staffing is to empower especially the head nurse to manage the deficiency of any employee during any shift, maybe in the morning shift, afternoon shift, or night shift. If there is any deficiency of staff, where there is a high census in the hospital and the employee absence is seen, it is very important for a head nurse to manage or to bring nurses from other departments where the census is less and manage the shift very effectively so that they don't miss any patient care. So another important objective in staffing is informing them about their holidays or vacation so that we don't limit their personal or family time with the patient care. And honoring their holidays or vacation should be within the limits and policies of the hospital. And at last, the important objective is to reward a person who works for a long term in an institution and an organization, because it is always equally important to respect their seniority by giving them rewards or providing them various incentives according to their seniority.